and welcome to yet another episode of Samajhdar Bano Sehat Ke Ishare Samjho, TV9 special with me Deepak Suresh Kumar in collaboration with USV, your reliable healthcare partner, and Beat Diabetes along with the Endocrine Society of India. Let me begin with something we all relate to, viewers. Most of us don't think twice before adding that extra spoon of sugar to a morning chai or enjoying a sweet after dinner. It feels normal, comforting, even harmless, but what many people don't realize is that long before diabetes is diagnosed, the body often starts sending quiet warning signals. And today we are talking about those silent sugar imbalances, the early signs we tend to ignore. And to help us understand this better is Dr. Rachna Kishore U, Endocrinologist, DHEE Hospitals, IGOT and Bangalore Super Specialty Center. Thank you, doctors, for being with us. And Dr. Rachna, from an internal medicine perspective, why is it that people don't really feel any symptoms in the early phase, even when damage may already be developing silently inside the body?
Diabetes is very rightly called as a silent disease. So many years prior to the onset of symptoms as well, the glucose level or the sugar is slowly building up in our body. So what the body is trying to do, like Dr. Pooja said, is it's trying very hard to compensate for this rise in sugar by rising your insulin level, or it's trying to adapt or adjust to this new level of sugar. So the patient per se does not feel any symptoms at this point. Maybe that is one of the reasons. And another reason is those classical symptoms we associate with diabetes, like in weight loss or increased urination, all of them may occur at a certain higher threshold for this patient. And since another thing is, since patients don't feel any pain or fever, or there are no very alarming symptoms, they don't usually rush to the doctor, and so it can remain underdiagnosed at this time.
Okay, Dr. Harshita, before I come to you, there's a follow-up question that people on social media are also asking Dr. Rachna. And we have a question from a person called Amit. He's asking Dr. Rachna, can poor gut health or frequent antibiotic use affect sugar metabolism over time?
Yes, 100%. That's a very important question, very relevant question as well, because what we call as, in medical terms, the leaky gut. That's the gut is responsible for overall complete health of your body. So when there are some what we call gut dysbiosis, that it's not working properly, many substances causing inflammation, what we call as cytokines, they get released into the body. So they are one of the cause for insulin resistance, for the glucose metabolism, lipid metabolism to go haywire. So yes, maintaining gut health is one of the core things for overall metabolic health, sir.
And Dr. Rachna, many viewers believe that eating home food, automatically protects them. From your experience, does home food always mean safe food?
So that's it's one of the most common things what we get asked in the OPD, that I'm having home food, but still my sugars are going so high. What I'm doing wrong? So having home food is definitely better. I 100% agree. But for the simple reason why home food is good is because we know with what ingredients we cook, with what oil we cook, how much we use, and what is the method of cooking. So all of these are important when we cook at home. But having said that, that does not completely protect us. We also need to keep in mind about the portion control and the balance of food what we're having. For instance, if you take half a plate of just carbohydrates like plain rice and a little bit of dal, that's definite. This simple home food is also going to spike your sugar. So following a plate method at this time greatly helps. Filling your plate, half of the plate should be any green leafy or non-starchy vegetables. 1/4 of your plate should be just any kind of protein, be it curd, paneer or egg or chicken. And 1/4 of your plate should be whole grains. So the less refined the grains, the better it is. Something like millets or quinoa or red rice or brown rice. Switching to these simple things than having plain white rice helps to get down the sugar a lot. Also be aware about what kind of oils we use. The refined oils we use should not be used much. Try having oils which are better in omega-3, omega-6 fatty acids. So those small changes when we do to our diet, definitely home cooked food is very good.
Also, Dr. Rachna, we have a follow-up question from Varun. Many people feel tired or thirsty often, and how do you know when it's routine fatigue and when it is sugar imbalance? How do you differentiate?
Okay. So that few things can help you, like in the sense if you have risk factors for diabetes, little bit your mind should also think about that can be one of the reasons. Like if you have a very strong family history, if you're a bit on the overweight side, bit on the obese side, or you have any signs of insulin resistance, or these kind of things help you to figure out maybe the fatigue can be a reason of high sugar as well. But fatigue is a very common symptom which can occur in even thyroid illness, which can occur in if your blood is low, if you're having anemia, or for sugar also. So depending on the risk factors you have, it's probably advisable once at least to get your sugars checked.
Food, and now it's time for us to speak about the tests. So Dr. Rachna, which tests give a more complete picture than just checking fasting sugar numbers?
Okay, so most common thing how they come to us is not even checking fasting. They come with only checking random sugar. So that's absolutely done at any time of the day. It doesn't give us much information other than if it's really high, maybe 400 or 500, it tells us that the patient really desperately needs help. But other than that, not much information by a random sugar. So for a comprehensive diabetic evaluation, we need to check the fasting sugars. Like ma'am said, we have to check the postprandial sugars. That tells us how good your body is in disposing of the sugar after a meal. And the most important test, that is HbA1c, which gives us a 3-month sugar average. So it says how your glucose levels have been acting in the past 3 to 6 months. So other than that, since diabetes is not only a glucocentric disease, so you have to think about the overall cardiometabolic health and the risk of the patient as well. So we do other tests like liver function tests, especially to check for something called fatty liver, because diabetes increases the risk of liver disease as well. And since we know diabetes is the most strongest risk factor for cardiac disease, for stroke, and for kidney failure, there are other tests like kidney function tests to say how fast your kidney is declining or is it normal? Is there any protein leak in the urine? And other important test is the eye test, which most of them forget because most of the eye symptoms, the eye damage does not have any symptoms until it reaches the end stage. So we mandate that every once a year, the eye screening has to be done. Other than that, important to assess your cardiac risk is your cholesterol also. Cholesterols have to be in a good range to minimize the risk of you having a heart disease. Having said that, it's just not about the labs. It's about the clinical examination, how we check the height, weight of the patient, the body mass index of the patient. And like Dr. Pooja said, we have to check the waist circumference to say it's the belly fat, which is the most harmful. So that gives us a risk of how this person is at a high risk for a cardiac disease or no. And like the others have told about insulin resistance, we examined like acanthosis, the dark patches. So all of this in totality will give you a comprehensive risk about where this patient stands having with diabetes and other complications in general.
Right, Dr. Rachna, we also have a question from Harshit, who is asking you, can chronic stress alone push someone from normal sugar levels into pre-diabetes?
Yes, sir. Definitely, it is possible. Stress and sleep are very important these days. A lot of, in the sense, importance is being given to that. That you should have at least 8 hours of good sleep should be there. And stress is a very important factor because it affects a lot of hormones in the body, which counteract the action of insulin. So one example can be cortisol. So when the cortisol level, when you're chronically stressed, not very small amounts of stress, when you're chronically stressed over a long period of time, definitely it can increase the hormones which oppose the action of insulin. So that can, if you are at a little higher risk, it can push you from normal sugars to having prediabetes.
And Dr. Rachna, I have a very personal question for you. You know, people have a notion that annual health checkups are very important, but what's the point of getting annual health checkups done when throughout the year you're doing all bad stuff, you're indulging in unhealthy habits through the year? So do you think annual health checkup after a year full of madness will help?
No, definitely. It's a very important thing to say. It's what's most important is being consistent. So many people before coming to the doctor, just maybe 2 to 3 months prior, sometimes just do some vigorous diet or vigorous exercise because they sometimes get told by the doctor that your sugar is so high and all of that. So in that way, people do some simple things and come just before coming to the doctor as well. But that's not what's important. That time, the sugar goes very high and sometimes very low. That kind of variability is very dangerous for the body. Actually, the body always prefers to maintain to be maintained in a stable state. So as long as you're doing something consistent, you're doing your diet, your exercise consistent for 6 months to a year, you will definitely feel much better. There is a lot of proven evidence for that, which says long-term, consistent these things, instead of doing any kind of crash diet, be it maybe keto diet, a low calorie, low fat, there are multiple 100 diets you can name, but following this simple plate method, choosing the right vegetables, just eating healthy, trying to avoid the maximum amount of junk, maybe just choosing it once in a while, maybe very small steps you can take, practice that for a week and see how it is going for you. So even though when we tell all of these diet changes, people are like, how can we leave rice? How can we leave ragi? They're all our staple diets, right? So what we tell them to do is instead of just ragi, add some other millets to it. And along with that, have a course of 2 bowls of fresh vegetables. Add a small protein in the form of egg or maybe curd, bowl of curd. So something like this, pairing it with the right kind of ingredients helps to flatten out this harmful effect of any kind of food what we're taking.
You know, people take it very personally and they get offended when you tell them not to eat their favorite dish or favorite dessert because it's not really good in the long run. Variations can really, harm the human body. And now, Dr. Rachna, we have Kishore who's asking us, how does alcohol intake affect sugar levels even when it is consumed occasionally? We have in the society, we have a lot of people. Some of them are frequent drinkers, some of them are occasional drinkers. Occasional drinkers, they say, oh, we don't drink every day, but we drink on occasions. So how, dangerous can occasional drinking also be?
It depends sometimes, in the sense, occasional drinking sometimes can classify as binge drinking also, that at one occasion they drink a lot at that time. That is especially harmful because what alcohol does is it prevents your liver from releasing the glucose, whatever is present. The stores of glucose in the liver become very low. So when your body is really requiring glucose, at that time your liver is not able to release it from the is not able to release it. So that's what happens after a binge drink. Very occasional drinking acutely does not affect the sugar level. Like one drink and then you check the sugar may not affect it very vastly. But consistent, like if you keep having very frequently, then yeah, like this kind of thing can happen. And the other end of the spectrum is very chronic alcohol use. There are people with alcohol use disorder and other things. So that what can happen is after a bout of alcohol, they may not have food. So their sugar reserves are already low and the liver again is not able to compensate. So that can be an issue. And sometimes when they have low sugars, they may not able to sense it as well. So the symptoms of low sugar also, they may not able to sense. But one drink and you just check a sugar may not make too much of a difference for that acute level at that point. But also, having said that, there's one important thing that chronic use of alcohol sometimes can cause pancreatitis. It's a very important thing. Pancreas is a place from where the insulin comes. So if your pancreas gets damaged in the process, then your ability to produce insulin comes down. And that is another kind of diabetes which we are seeing on the rise in India and as well as the world, which is called as pancreatic diabetes. So that's definitely something to be kept in mind.
And finally, Dr. Rachna, people say life is short, make it sweet, but that's such a very wrong statement. You can't really make it sweet, right? The more you make it sweet, the more you have diabetes and sugar issues. So before we close, what is your one message for the viewers who are watching us?
Okay, so today I think we have extensively discussed about what is diabetes, why it is so rightly called as the silent killer, and it is one of the major driving factors for the mortality in the country in the form of cardiac disease or a stroke or a liver or a kidney disease and all of that. So we have also discussed about how we can take simple measures to in our normal day-to-day life without making a very big change, but taking small consistent efforts every day to make a big change. So one takeaway message, what I want to say is before the sugar crosses the line, please get it into a hold. Your body will always give you very subtle signs to identify that something is wrong. Maybe not very alarming signs, but if you're be smart to listen to these kind of signs, pick it up early, recognize what they may mean, and test and treat early so that you can prevent all of these complications. Since diabetic, pre-diabetes, and obesity is like a worldwide epidemic, I think test, and treat and to prevent complications early is the way to go now.
Right, Dr. Rachna, Dr. Harshita and Dr. Pooja, what an insightful conversation this has been, because diabetes doesn't announce itself suddenly, it develops quietly, step by step, and the real danger is not sugar on the tongue but silence within the body. So being smart means listening early, which clearly goes on to say that Samajdar bano, sehat ke ishare samjho. This is the takeaway. Thank you, Dr. Rachna, Dr. Pooja and Dr. Harshita for joining us on this insightful conversation. Well, viewers, the takeaway is that you shouldn't avoid and you shouldn't ignore early signs inside your body, because these early signs could develop into a major problem that you will not foresee in the future. So whenever you pick up a sign, it's time you go to the doctor, get yourself checked up, and as it clearly says, Samajdar bano, sehat ke ishare samjho. That's the takeaway, and thank you for watching.